After study has found we are a sleep-deprived nation.
And not just adults. It turns out kids are often sleep-deprived, too. CBS 2's Dr. Max Gomez explains why the American Academy of Pediatrics is endorsing a new set of sleep guidelines for children.
Let's get your shoes on.
At the Wingate house, keeping up with 8-year-old Grady and 5-year-old Ginger is nearly a full-time job.
It's challenging to get them in bed by 8:30, and then school starts at 8. So, you know, we struggle with it at times.
Experts say getting enough sleep is critical for kids, not just for their physical health, but also to help with their behavior and learning. That's why the American Academy of Pediatrics, for the first time, is supporting specific sleep guidelines for children.
Decreased sleep can lead to hypertension, which is high blood pressure. We know that it can lead to obesity. In teens, it can lead to depression, and in adults as well.
The new recommendations say infants from 4 to 12 months should get 12 to 16 hours of sleep. Children 1 to 2 years old, 11 to 14 hours. Kids 3 to 5, 10 to 13 hours. 6 to 12-year-olds, 9 to 12 hours. And teenagers should get from 8 to 10 hours of sleep. But many children are too overscheduled to get enough rest.
Sometimes you do have to think about what is it that my child really enjoys doing. Those are going to be our priorities, and maybe we don't need to do every sport.
The Academy also says parents should establish a routine to make sure their kids get to bed on time.
You want happy, healthy, rested children. It makes parenting a little easier. Let's go.
And turning off TVs and computers 30 minutes before bedtime is a good place to start. And by the way, just because your child is going to bed at a reasonable hour does not necessarily mean they're getting enough sleep. Teens are often texting well after bedtime or even waking up to text in the middle of the night. If your child seems unusually sleepy, check to see what they're doing on their phones or computers at night. We found out that they do a lot of that at night, and they're not getting the sleep you think they're getting.
Really.
I know, I'm stunned.
My daughter did not sleep when she was 1. She's not sleeping when she's 21, as far as I know. It seems not to change. It almost seems like they're born with a certain pattern.
Yes, that's true, but they can also fall into those patterns, and that's what you want to discourage.
Okay.
Thank you, Dr. Max.